Good afternoon, everyone, and welcome to this Outcomes Challenge webinar. Thank you for all joining, and this is bringing together our community of innovators. We're very excited about today's topic. It's social media. As a reminder to the callers and to first-time participants, this webinar is being recorded and will be available on our challenge website. You'll be able to look at it afterwards, so please remember that this is being recorded. If you prefer to ask your questions anonymously, please use the chat feature within the webinar. Send the messages to the host, and I will ask your question on your behalf. Also, we will be following up this webinar with an online evaluation. Please take the time to give us your feedback. We're always interested in knowing your feedback and being able to respond to topics and questions that you would like to have during these webinars. As many of the challenge teams, we know you're anxiously awaiting the results from the momentum phase. We anticipate having these results soon. We'll be sending out announcements to teams and media, but also keep checking the website. So we anticipate that very soon. We thank everyone who has been participating, and you're doing a great job. And this job is noted again for our Speeding Encouraged drive to the next million. So congratulations to all of the teams who have been pressing the gas pedal and driving us towards the next million. As you can see, we are progressing at a very steady pace. We encourage all of you to continue to accelerate. Remember, $5,000 is at stake for one team when the checkered flag is waved. Just to remind you, so today's webinar is about social media. However, we do have two more upcoming webinars scheduled. One is on e-prescribing on December 5th, and the other one is about mobile health on January 22nd. Please mark your calendars. We look forward to your participation in these events as well. So without further ado, I would like to introduce our speaker for this webinar on social media. Tracie Risling is an assistant professor in the College of Nursing at the University of Saskatchewan. Tracie is engaged in research on communities of practice in healthcare, as well as examining the role of technology, including social media tools, in connecting educators, students, practitioners, and patients. So please welcome me in joining Tracie. And just a reminder to everyone, please mute your lines if you're not asking a question. We do get some feedback, so if you keep your line muted, that will go better for us all. But we also don't want you to be afraid to ask questions. And Tracie, you can let people know if you want them to ask during your presentation or after or whatever works for you. But over to you, Tracie.
Well, welcome everyone. Good afternoon. It's really my pleasure to be here and speak on this webinar on social media use in healthcare. Social media has long been a passion of mine, and it is a highly topical conversation right now. In fact, through my own Twitter feed this morning is more upcoming webinars and sessions and conferences on social media and healthcare. So it is very topical. So my thanks to Infoway and to the ImagineNation program for letting me be here with you all today. If you want, you can, and you are a Twitterer, a user of the Twitter, you can follow along with me today. My hashtag I will send out to you here on Twitter. Starting in a couple of minutes, there'll be a series of auto tweets that contain resources that I'll be discussing with you over the next half hour or so. So today we're going to talk a little bit about the influence of social media, a very brief look at Social Media 101, some resources for you, and then really delve into what are the issues of social media in professional practice, some of the strengths of some of the challenges, take a look at patients' perspectives of tools in clinical practice, and I have a whole swack of resources to share with you today. And if you haven't been a big user of social media, or you're wondering if it's right for you or your clinical group or your clinical practice, maybe you'll be inspired to get started today. All right, it's no secret how social our world has become. Usually, very often when I give this talk, it's not to a group of clinical innovators, early adopters, informatics experts, etc. So I will do the early adopter version of this part of the spiel, and I don't have to convince you then of the influence of social media that has really enveloped our world. Talk about a global community. We mean that no more than we do now, and social media is a huge part of making those connections. So just a few examples, just from our world in the last few months. Of course, the election in the U.S., Obama's extensive social media use, and the expertise with which his team utilized social media, both in his initial campaign and in his re-election, is really contributed to having, made a positive effect in putting him back into the White House. So those tools and that connection with people is almost essential now. I don't know there would be many politicians out there that would think about going through a national campaign without some sort of social media connection. World conflicts, I just found it so amazing last week. I think this is really speaking to this ever-growing influence of social media, is that the Israelis, attacked Hamas in this ongoing conflict, but then posted the attack just a few hours after it happened up on YouTube, showing the attack, showing what had happened to this Hamas leader. It went viral. It was all through my own Twitter feed, and many, there was discussion then, should YouTube take it down, etc., what should go on, and of course it's still up. And if you look at all of so many of the world's conflicts and the role of social media in places now where journalists aren't even, and yet the people who are living through that are using phones, using other tools to record what is happening in the here and now, and all of that is going up on YouTube, all of that is being highlighted on Twitter, and it's amazing really what the tools are doing. Of course, Hurricane Sandy is another example. And really, I find with all breaking news, the news outlets are so quick to get to the Twitter or to get to their own news posting and sharing sites that, if something is breaking, I find the first place that I typically turn to try and get a handle on what's going on is some of my social media tools and sites. So now, of course, we can't ignore the amazing volume of other information that flows through the social media channels, right? What you had for lunch, your favorite restaurants, your sad breakup, and on and on. And there's a great deal of the inappropriate and non-useful as opposed to, professional tools and really quite useful information. And so that is something to consider, and something I think that frustrates people who are thinking about using social media is kind of how do you wade through all of that to get to the parts of it that you're actually interested in, and we'll more about that. But then healthcare. What about healthcare and social media? Just this morning, actually, in my own Twitter feed was a link to a report. It was actually released in the spring from PricewaterhouseCoopers from their Health Research Institute on the use of social media in healthcare. This is a U.S. perspective, more than 1,000 U.S. adults surveyed, to find that 1/3 of them, those surveyed, are using social media for their health discussions. And according to the survey, 42% of consumers have used social media to ask health-related consumer reviews, 30% have supported a health cause, 25% have posted about their health experience, and another 20% have joined a health forum or community. Those are not small numbers. So that's part of the reason we're talking about social media today. All right, let's take a quick look at the statistics, a 60-second look, let's say. So in the time we're reviewing this slide, this is what's going on in the realm of social media. It's quite astounding to think of the volume of collaborative work and sharing and connection that goes on. So 98,000 plus tweets, 100 plus LinkedIn accounts, news accounts being created, 600 new videos posted to YouTube every 60 seconds. So it's quite staggering when you take a look at it in that context and think about the worldwide use. Okay, again, since you're all such a savvy group, but just to make sure we're all on the same page, of course, Web 2.0, the term surfaced in about 1999, and then was so gratuitously used, I think we're all quite sick of it by now. But essentially, just to get us all on the same page, what we're talking about there is a change from what was a very static kind of Internet to an Internet and web tools and opportunities that promoted collaboration and really allowed people to connect and share with one another. And so then we have all of this. We have your Facebook, YouTube, Twitter, which is a microblogging site, all of the blogging sites that are available on a multitude of platforms such as Blogger or WordPress. Pinterest is fairly new to the social media realm, but it took off like crazy. It's increasing as millions and millions and millions of users. Essentially, it's a bookmarking site that uses visual images, and you can bookmark whatever is of interest to you. And then we have social news websites like Dig or now Reddit as well. These are interesting in that it is the community members collaborate, vote, if you will, on items, and therefore move these items up and down kind of the popularity chain in these social news websites. So it's very interesting if you want to get a read about what is of interest to that majority of people. Those social news websites are really useful. All right, so if you need to get started, here's some resources for you. The social media cheat sheet is great. It's essentially an infographic that covers everything we talked about on the previous slide, and some very basics of each about how to get started. There's some great resources there on Twitter. And I also threw in an infographic about the pros and cons of social media. I use this a lot. I'm an educator. But a lot of the clinicians of our future will be coming through our education systems, and I thought it might be useful for you to see how education is using social media and what we're using it for. So I included that infographic there for you as well. Basically, essentially, the reason I've been so engaged with social media is because I've really seen how it can support the creation of community. My research when I'm not working with social media and social media tools is centered on communities of practice. I'm sure many of you are familiar with that concept, and social learning theory. And I have to say that the further I get into my research, the more and more I realize how huge social media is going to influence my future research over the next couple of decades. So for me, there's still going back. I'm connected with social media whether I like it or not, but you really do have to think about the power that it holds in creating community. I think that the Internet in general and social media tools and groups specifically have really helped create this atmosphere, this condition where there is a place for everyone. So you could be in the most specialized niche group, one amongst millions, but yet you can get online and you can connect with other people who share your common interests, no matter how specialized they may be. So whereas people were quite isolated in their interests or in their needs, now through the power of social media and through the Internet, these people are connecting on a global level often and creating some really quite powerful groups for themselves. So from that same PricewaterhouseCoopers report that landed in my Twitter feed this morning, what they did was evaluate of social media by industry organizations and then compared that to consumer activity. And I wanted to share with you, although 8 in 10 companies evaluated in the survey had a presence on various social media sites, the volume of activity for companies is in the hundreds, so the hundreds of likes or reposts, but the volume of activity in community sites is 24 times that. So 24 times more likes, more activity through these community-created, these would be, patient or client grouping sites, as opposed to, big institutions, big insurance companies, etc., who are also using these tools. I think it's really worth asking, who is in control right now of this social media situation? And I think that statistic alone should really remind us how important it is to get out there and to get information out there through these kinds of channels. All right. How about social media, the personal versus the professional? Maybe many of you are already huge fans of social media extensively in your Twitter feeds or other things. An evolution. I'm a professor. I have a personal Facebook page. I never mix that personal Facebook page. I don't become friends with my students, etc., etc. Twitter feed was the same. I used to have two Twitter feeds. The one with the link I sent you to now at Tracie was here, and then I had a Prof one as well. And eventually I found it was just too much time to try to maintain that dual identity. And so when it came to Twitter, I collapsed it all on one. So there's a warning for you. You may choose to unfortunately following this presentation, because although I do like to share lots of information about social media and technology and education and my research, I also might share, that the dog ate the kids' sandwiches out of their lunch kits in the morning. So, and actually a lot of people who are at work in educational technology and social media do have this really kind of odd mix in their Twitter feeds. So there's a caution about that. I think for most of us working in healthcare, working in clinical situations, we really do need to embrace that dual citizenship model, however. You need to create a Facebook page that is specific to your clinical practice, or a Twitter account that is, again, specific to your clinical group or your clinical practice. And I think that in healthcare, even more so than in business or other disciplines, we operate under very strict guidelines, often regulated by codes of ethics, that do dictate how we handle privacy and confidentiality. So, I'm sending out an auto tweet on 5 keys to social media for healthcare professionals. Some great tips there. Knowing what you want to accomplish with your professional social media tools. What's the message that you're sending? And the tip here is to create a 90-day messaging plan. And I think that's a great idea. What are the messages you want to send? What's the audience that you're trying to connect with? So to be very clear in your voice, use your professional accounts to follow people, peers, leaders in your field that will help you to share messages that are of value. And you have to plan the time. It is a time commitment. I'm not going to lie to you. You've got to kind of get it going, get it on your schedule, and make the commitment that you are going to engage and utilize these tools. Stale social media is unutilized social media, right? When your feeds or your Facebook goes silent, then you can lose of the community that you're trying to reach out to. I like the tip on the tweet that's coming out. It says, listen twice as much as you talk. Part of the commitment of social media is listening. And I couldn't agree more. Unless I'm at a conference or I'm doing this, my Twitter feed can be quite silent, actually. But I love to listen to it. So yeah, I find it incredibly valuable. So. All right, let's talk about social media specifically in healthcare. There's an auto tweet coming out about Health Canada. It may be out already. I kind of scheduled them about 5 minutes apart. So, and I don't have my own Twitter feed open here. So, but it should be out. And Health Canada has an entire page related to their use of social media. Just like a whole list, all the tools they use, all the ways in which you can connect with the government and with Health Canada through their social media programming. I was quite surprised, actually, even myself this morning, to see how extensively they were invested. So that's a great link for you to check out. Of course, hospitals, other healthcare centers and institutions are embracing Twitter. Again, I'm sending out, auto-tweeting a link from Snitch, which is an organization I'll share a link to you at the end, of their hospital social networking list. This is a list of all of the hospitals and institutions across Canada that are currently using social media and what they are using. So are they on Facebook? Are they on YouTube? Do they have a Twitter account? So that's a great, again, just to get a snapshot across the country and see who is utilizing what. So that tweet will be coming out as well to you. Healthcare groups and associations, not only does the Canadian Cancer Society embrace social media for its own use, it also funds researchers or project teams that are willing to create education campaigns utilizing social media. So that's a great investment. Canadian Diabetes Association, I mean, really, any group you can think of really healthcare related that is operating typically tends to have quite an extensive social media presence. And then there's patients and clients. Again, a huge group. That's that 24 times, right, are these patient communities. So patient advocacy groups, patient safety groups, all heavily invested in the use of social media. How about some concrete examples for you? Just so you know, I'm not making it up. As far as Twitter goes, I was going to share with you from my own health region. I'm in Saskatchewan, in Saskatoon specifically, and the Saskatoon Health Region has just finished their flu vaccine campaign. I don't just know this because I know follow the Saskatoon Health Region on Twitter. And so when they started their campaign, they tweeted about it. So I knew where the flu vaccine clinics were, why I should get my flu vaccine, right? There was an education piece. Then there was great information like, hey, there's no lineup right now. You should come down now if you're interested in getting your shot. There was a little hiccup in the vaccine, as some of you may know, and so there was information about, the suspension of the clinics, and then reassurance about why everything was fine, and then again, more tweets about starting it up and finishing it off. So there's an example, I think, for you about Twitter. Twitter has been used to track disease outbreaks, to promote these sorts of things. There are a lot of examples that I could share, but there's one from just recently from my own neck of the woods. Facebook, I am auto-tweeting you a link as well to a really interesting project that was done. I don't know if any of you are familiar with the Khan Academy, but it's an educational tool essentially where we promote learning by sharing with the students ahead of time so that when they come into the classroom, they are able to do some active hands-on learning. And what I shared with you is a link to a YouTube account from a physician where she is sending information to her patients ahead of time. So she's posting information about things like how does a baby's growth chart work, or how would I give my baby Tylenol. And so she's posting on YouTube all of these, essentially flipping her patient visit, right? So she's taken some of the things she spent a lot of time discussing with clients and patients in her practice and put it all out on Facebook and made this available to the patient. So now when they come to see her, they kind of move past that part of the information, and she's able to spend some more time with them, really delving into, what are their specific issues and having extra time, to provide kind of a deeper level of care. So there's some interesting things there. I'm also posting a link to another article that talks about how social media can influence your healthcare practice. And Chris Keating is featured there. He's a physical therapist, talking about using Facebook. So they would have created a Facebook page for their practice to find out what services and events are really of interest to their clients. What could they offer that would be of interest? What kind of hours would work for their clients? All kinds of things. And this information is readily shared by the clients of this physical therapy practice through their Facebook connections that they have. So YouTube, we talked about Dr. Swanson, and there are many doctors and so much healthcare information on YouTube. You could spend an entire day searching through all of the different information there is about healthcare on YouTube. Some of it very, very good, and some of it problematic, of course. But it is a great tool, and it is being heavily utilized. LinkedIn, many of you may be familiar with this. A lot of the networks that I am currently involved in, an RN network, for example, a Simulation in Healthcare Society, those conversations carry on in LinkedIn. And, if Facebook makes you cringe and you're not quite ready for, that sort of social media, I think LinkedIn typically considered to be, quite the professional, more professionally orientated, and less Facebook around the edges for sure. So, but there is a huge amount of connections going on there, and I'm sure many of you take advantage of that. There are so many others. This just scratches the surface. I mean, honestly, we can't even rule out Pinterest as a potential health-sharing community. I mean, right now it appears to be about, what you're making for dinner and how you're planning your wedding. But in all honesty, the power of Pinterest to kind of morph into an information-sharing health community, it's there. All the tools are there for that to happen. Some of the strengths of using social media for your professional use, I think hopefully what today is demonstrating for you is that there are professional benefits of putting social media to work for you in your setting, no matter what it is and no matter what client group you may be working with. It really is that ability to create connection, not only with perhaps with your patients or your community, but with your own peers. Right now, I have to say by far, my most valuable resource in terms of accessing current information and news and developments in my areas of interest is my Twitter feed, hands down. It just amazes me how many links to information come in that feed every day, and then I'm saving off in different files and different things. So for me, I would never shut down that feed. It's been far too valuable and allowed me to make far too many connections. So you have to make it work for you. Find someone that you admire, that's a leader in your field that you feel is really of value. And then what I tend to do is once I've found that person, if we're talking about Twitter again, find out who they follow. Who are they connected with through these kinds of social networks? And then I connect with those people as well. It takes time to build a network that is really useful and will be really valuable to you, but it is such a worthwhile investment. I can promise you that. What about some challenges? Well, when clinicians are polled about why or why not they might engage in social media use, time management almost always comes up. It is timely. You need to learn the tool. You need to use the tool, and you need to be consistent, as we've discussed about using the tool. So there is that issue related to using social media. I mean, some people feel like they're drowning in their inbox, right, and their email is enough. And they don't want to add in, any of these other things. But keep in mind that there is research and there are clinicians out there that are sharing their stories, again, about how much time it is saving. If you find yourself answering the same question over and over and over and over again for your patients and clients, post it on YouTube. Start a Facebook page. Make a newsletter or a news section in your Facebook. Or send it out to your Twitter feed and give people that education that they're looking for. And then it should be a time saver, really. I think for me, again, that value of having things just delivered into my Twitter feed that I would not have the time to go out and look for, but because of the learning network I've created for myself is just dropping right, before my very eyes. To me, that's a huge time saver. There are issues, of course, with professionalism. Again, we are regulated extensively by, codes of conduct, codes of ethics, and in our field, maintaining that sense of professionalism is very important. That's why you can't utilize your personal Facebook page, through your practice. I mean, it just wouldn't work. And again, you really have to think about your professional presence. When I teach my undergrad nursing students, I take them to a site at UBC called Digital Tattoo, and it's a real wake-up call to them about their digital footprint and how permanent it is. And that's where ownership comes in, too, is sometimes once that tweet is out there or that data is out there or that Facebook post is out there, you could try to get it back, but chances are you won't. And so it's that idea of who's maintaining ownership of these messages, of these data, and then what happens to it. Once it's out, it's out. And so you have to be very cautious that you're not making a misstep that is going to impact on your professionalism or is going to be an issue for you in terms of the data that was shared and that is now kind of out there. And I think we've talked a lot now about the regulations, and there's some really good resources here at the end about how healthcare practitioners and clinicians can try to manage issues of privacy and confidentiality while using social media. I send auto-tweeting a smidge link on this as well about the top 5 reasons why your doctor is probably not using social media. Quite a few we've just discussed and are on this list. No time. The system doesn't compensate physicians for patient engagement through social media, regulatory environment, the lack of knowledge about the technology, and the lack of a proven clinical benefit. So, we've really covered this list, but I think, today, you're learning a bit more about the technology, and there is research coming out every day, almost now it seems, about the benefits, about the potential power of social media in healthcare. So that last point about the lack of proven clinical benefit might be eroding fairly quickly here. Okay, so how about the patient's perspective? I included this picture for 2 reasons. First, I think it's important to remind ourselves about who is coming, right, to us. And by that I mean our future patients, our future clients, our future clinicians, right? There they are. My youngest son is 10 now, and when he was 7, might have even been 6, he was busy doing something on the computer, and he came to dinner that evening, and we said, oh, what have you been up to? Oh, I was just posting something on my YouTube channel. To which his father and I replied, you're what? Yes, so the 7-year-old, without any assistance or knowledge from us, he creates his own YouTube channel, creates his own videos, and then proceeds to post on his YouTube channel. So if you think about where we are all at as a generation in terms of our comfort from social media, that's one thing, but you have to think about the generation that's coming now behind that has known nothing else but utilizing these kinds of tools. So that's maybe an interesting and or scary thought. So this picture also represents, I think, patients supporting one another, right? They're building these incredible information and sharing networks. And these patient communities can be a great source of information for healthcare providers. Essentially, if you want to know what the top issues and concerns are, you're going to find them in these community groups and in these community conversations. And if there isn't a group or a community or a patient group for the client that you work with, it's a great opportunity for you to start one, and that at least you can participate and share information. It has been noted in some of the links and some of the articles that I've shared with you today through the auto-tweeting that you can actually, if you have it filtered right, watch trends develop on Twitter that could indicate a need in the community. And I think we'll see more of this, where you actually would see a trend develop where you would understand that more information was needed on this topic. And of course, then as healthcare professionals, we have to be ready with the reliable and valid information, the timely information that is of use to the community that's seeking it. And there's also a link at the end of this article, at the end of the presentation to an article by Dr. Claire McCarthy. It was posted on the Huffington Post. And I think she summed it up so perfectly. She talks about how social media and healthcare is really about communication and about relationships, and how clinicians can learn things from their patients and from other clinicians. And I think what she said that I really found quite profound was that social media takes science and technology and mixes it with 2 fundamental human needs, relationships and communication. Sounds like the perfect prescription for healthcare, Dr. McCarthy says. And I couldn't really agree more. This last link on this slide, if you're able to open it, is a look at Crohn's disease in social media. Again, I picked a patient group, an area of interest. You, again, can see the multitude of ways in which, if you are a patient with Crohn's disease, you can seek community and support through social media. what to do today. Choose one social media tool. If you are not as familiar with some of these, may I suggest that you do try a personal version first, just so that you can experiment a little bit, try to figure out how it works. Use YouTube. My now 10-year-old will tell you anything you need to learn, you can learn on YouTube, which is terrifying to me sometimes because I like to try and vet that, what exactly is being learned. But he's actually correct. If you want to learn to use any of these social media tools, you can find a video on how to do it on YouTube, and also just through searching, and of course all of the tools themselves typically have lots of tips and tricks about how to use them. May I also suggest, if you do nothing else today and you are already engaged in the use of social media, that you use a management dashboard. I auto-tweeted a link to Hootsuite, which is a social media management tool that I use. Also, TweetDeck and CodeTweet are other ones. Essentially, this aggregates everything all together so that you're not, trying to open up 4 or 5 different things and communicate with people and send tweets and follow things. So, and really, it really applies to this last point, the use of a tool like Hootsuite or TweetDeck, is that you can search and save hashtags. Okay, so what do I mean by that? I mean, if you're familiar at all with Twitter or even other social media tools, not just Twitter uses hashtags. These are really great links. I wasn't actually aware of the healthcare hashtag project before I prepared this presentation for you all, so I was happy to find it myself. Essentially, it's a listing of hashtags that aggregate information for you. So if you're really interested in, social media and healthcare, there's a hashtag for that. And essentially, you just use your social media management tool. You save the hashtag as a search, and it starts to just kind of waterfall. All the tweets that are coming through about that are all gathered together. So you don't have to have one Twitter feed that is just a mess of everything. Using hashtags, what you can essentially do is create mini digital libraries per topic. Okay, and it is unbelievable. The healthcare hashtag project, it doesn't matter what field you're in now, I guarantee you there's probably a hashtag out there for you. And you can use any of these links to get started and find yourself some great hashtags to follow. And you'll be amazed at the information that is being shared and the resources that you can gather so quickly utilizing these kinds of hashtags and creating these kinds of networks for yourself. For more resources, again from the CMA, Clinical Vignettes on the Ethics of Social Media Use. This is a PDF document. It is fantastic. It covers everything from email and texting to Facebook to Twitter, and it really delves on a much deeper level into issues of privacy, confidentiality, professionalism, some of the things we've just had time to touch on here today. There's a social media overview, the Snitch group, sharing info on social media in Canadian healthcare. That's run by Dave Bourne. I gave you the link there. And I did send out an auto-tweet following at Colleen Young. She facilitates the healthcare social media Canada hashtag. They are actually tweeting right now. They have discussions. You can put a number sign in front of HCSNA, and that will create the hashtag you need to become a part of that conversation. And it's a great one. Colleen Young is a great resource, and there is a lot of work being done right now on healthcare and social media in Canada. There's that link to the article by Dr. McCarthy, Why Healthcare Needs Social Media. And just in case you didn't have enough to review or you're interested in, there's actually 5 social media books to read if you're really interested, or you have some seniors in your practice or office that are very interested on the inner workings of social media. I think that's it. The last tweet that will be coming out to you is a great report again from the CMA. It's actually their November 2012 edition of Future Practice. And essentially, wow, it's pages and pages of validation about how you made a great choice to be here today and learn more about social media, and again, that actually has great information about Infoway, about the projects that are being done and how we're all working together to move Canadian healthcare practice into the future of technology and the adoption of different kinds of tools. So thank you very much. I'm happy to open it up to questions, and I really appreciate you taking the time to learn a bit more about social media.
Well, thank you very much, Tracie. This has been very informative. I'm sure there are lots of questions, so I will be the moderator here. If you're planning to use the WebEx to pose your questions, please type them into the host, and we will then say them on your behalf, or we're also opening up the phone here so that if you are on mute, take yourself off mute so that you can pose your question. And if you're not posing a question, just a reminder to please mute yourself so that for the benefit of everyone else, so that we can hear all the questions being asked. So one of the things right away, Tracie, that I found interesting was that you said if you're going to get started in this, you should create a 90-day messaging plan. Can you maybe just sort of tell us a bit more about what kind of goes into that plan, and is this something that we're doing every 90 days, or is it just to get us started?
Great question. Yeah, I really, again, I'm trying to think of the tweet that belongs to that. It's at the bottom of a link about the use of social media in healthcare, and at the very bottom of that link, the author shared these 5 tips to really being effective in using it. And I really enjoyed that because I think that when we use social media in a professional way, you really need, before you even begin, before you tweet a thing, you have to decide who are you trying to connect with. So not only just a 90-day messaging plan, but really that communication plan. What are you using social media for? Very often, we can be tempted to use technology just for technology's sake. And in education, we always say the pedagogy has to drive the use, right? So you can't just use Twitter in the classroom because it would be fun. What is it accomplishing? And so I think that's part of that. So once you identify what's the community that what are you trying to accomplish, then I think in that 90-day messaging plan, you really think about how you would build community if you were having, say, a focus group come in and meet with you. So you would start off with some introductory information and points, something a bit lighter, right, to bring people in, to get people interested. And then as these 90 days go by, you think about, developing, maybe delving into deeper information, sharing some more educational tools. What I think about is we run a learning community here as part of our nursing program, and we have a Facebook page and a virtual community associated with it. And one of the biggest lessons to learn about social media is consistent use and posting. So why I think that 90-day plan is really valuable is that you understand, is it every day, is it twice a day, who amongst your clinical group is going to contribute and be responsible for working on this plan. One is to make sure you keep your community engaged, and 2 is to move the messaging, through a kind of an arc or, through a transition that makes sense from introductory, hi, isn't this great, and something lighter on a Friday maybe, and you kind of mix it up in that way, and then share that the hard-hitting messaging, that education piece, or maybe you get to a point where you'd like to survey your community. What would they like to see? And these are the things that I would put in that kind of plan.
Tracie, you mentioned about building your network. So does that mean you actually have to cull your network as well?
I think that's a good point. Can you give me an example of what you're thinking of there?
Well, I'm just thinking as you get started, you said you sort of follow someone in particularly, and then you see who they're following, and so on and so on. And then at what point does it become unruly and you have to kind of say, hey, are all these people worth following? So I just wonder if is there a strategy for that, or you just keep letting it grow?
I mean, in my main Twitter feed, I just let her go. And, you know, people follow you, and, you know, you follow other people, and it kind of goes around and around like that. But I think really the key is the hashtag. Over and over again at conferences and when I, you know, speak with people about social media, those hashtags are key. If you are interested in a very specific amount of information, right, coming out of a Twitter type feed or another social media, aggregating it by topic like that is really valuable. The great thing, the great benefit about hashtags that maybe didn't make clear is you don't have to be following the person who used that hashtag, right? Because you have searched the hashtag, everything that is tagged with that will come through your feed, whether you're following the person or not. And so people and social media experts far beyond my expertise will say the same thing. Hashtags are really key. Yeah, sometimes I do. You know, you can't turn it's like the ocean. You can't turn your back on that Twitter feed, or I sometimes get obsessive. Did you read every single tweet? And there's days where you just can't. You know, you just have to let it go and hope that if it was really great information, it'll pop back up. But when you're finding those really important resources there, it does become a bit of a compulsion to check back in and make sure. But again, hashtags is really a great way to make sure you are capturing that. And the other great thing is the favorite tweets, right? Sometimes, you know, I'm in quite a rush, or I'm waiting for a meeting to start, and so I'll just open up my Twitter feed quickly. I'll see 2 or 3 resources that I want to check out further, and I don't have the time to open all the links and see is this actual, you know, kind of valid research, or is this just someone's random opinion. So I'll just favorite them, so you just star them all. It saves it in a separate feed for you, and then when you have time, you can go back and invest in looking at those resources you were interested in. So there's 2 tips for that.
Great, thank you.
When we consider healthcare organizations looking at a social media strategy, that will require a level of investment, really, to increase, you know, your communication staff complement, or however you propose to do it. I'm wondering if you're aware of any research ongoing that would support and justify such an investment.
Oh, absolutely. Yeah, a lot. Even that first report that I tweeted, that Price Waterhouse Cooper report. Now, again, that's a report. But, I mean, you're correct. In very large clinical groups or organizations, and you're so correct about 2 things. One, that it is an investment, and 2, about needing a communication person or someone whose role it is to be invested in this. I think those are 2 really great points to make. But, you know, I've just scratched the surface for you today, and again, those resources are going to be sent to you about how much, you know, benefit for patients, you know, better outcome, better access information to manage chronic health disease, decreased time, you know, being utilized in clinical areas because patients already have access to some of that information. So, you know, go through what I sent you today, and there would be more out there as well. And there's those of us, myself included, who are continuing really to do research in the areas. Value is there, and I really think that, you know, it's too big not to buy in at this point. There will always be challenges, and really there are, you know, serious issues and concerns that need to be really carefully considered. And I'm not here to tell you that social media is the be-all, end-all solution to your, you know, to your clinical communication issues, but I'm saying it's worthwhile thinking about making that investment for sure.
Tracie, we've had a question come in posed through the webinar. The question is, do you have experience or do you know of anyone who has used information posted on social media sites for inputs into qualitative research? And is SM social media used in this way yet?
Oh, absolutely. Oh, for sure. Like I said, a colleague that I know, our booth, I should pull up that, he is also giving a seminar through the Canadian Nurses Informatics Association in a couple weeks, I think, on social media and healthcare. And one of the articles he sent around was the use of Twitter in pandemics. There are a lot of examples now and about, you know, Twitter feeds the narrative analysis being applied to Twitter feeds or other social media sites. So, yeah, if the question is it evading, is it coming into, research tools and techniques? Yes, it's arrived, and quite handily so.
Well, Tracie, thank you very much for enlightening all of us on this topic. I know myself, I'm pretty nascent when it comes to some of it, so it's good to hear all of this great information, and that we will make sure it gets passed on to all of the participants today. So that was this has been fantastic. Thank you very much.
Well, it's my pleasure to be here, and thank you very much for the invitation.
Thank you for your participation today. We look forward to you joining us in December for our next webinar on e-prescribing. And until then, all of the ImagineNation Outcomes Challenge teams continue to drive to the next million. Thanks a lot for your participation today. Have a good afternoon.